Hey everyone, welcome back to our channel. In today's video, we're going to be talking about how to manage allergies. Allergies can be a real nuisance, but with the right strategies and tools, it's possible to find relief and feel better. So if you're ready to learn some practical tips and tricks for managing your allergies, keep watching. Allergy. What exactly is an allergy then? An allergy is an abnormal reaction of the body to a foreign substance that results in contact with another substance. Even if the substance does not harm the body directly, it still has an effect on the immune system and triggers a response. This reaction has the potential to cause a wide range of symptoms, each of which can make the affected person uncomfortable. In response to the foreign substance that has invaded the body secretes chemicals in an attempt to defend itself and better cope with the situation. It is not necessarily the case that a person is allergic to a substance simply because they react negatively to it when they have never shown this before. A substance allergy means that an individual will experience the same symptoms each time they come into contact with the allergen. For example, there are potential adverse effects associated with the use of many different medications. It is not necessarily true that a person is allergic to a drug simply because they experience a negative reaction to one of its side effects while taking it. In turn, an allergy is something a person can overcome or something they can suffer from once or twice and then never again. Both of these scenarios are possible. During an allergic reaction, your eyes may itch and water, your nose may run, and your skin may develop a rash. An overreaction to a foreign substance is what doctors call an allergy. Allergic reactions aggravate the already existing irritation of the senses of sight, smell, taste, and touch. If the symptoms of an allergy are not managed properly, the condition can become extremely dangerous and, in the worst case, even fatal. If you experience any of the symptoms described, it is in your best interest to seek treatment from a doctor or medical facility as soon as possible. There are many manifestations of allergies. There are many types of allergies, the most common of which are hay fever and nose allergies, skin allergies, drug and medicine allergies, food allergies, and insect sting allergies. Pollen, found on grass and trees and often floating freely in the air, can irritate the nasal passages and cause allergies known as hay fever and nasal allergies. Both of these types of allergies tend to be seasonal in nature and tend to get worse in the spring. Allergy symptoms. Keep an eye out for these common allergy symptoms. The severity of allergy symptoms can cause them to manifest in different ways. There are 3 levels of severity that can be attributed to allergic reactions: mild, moderate, and severe. Symptoms get worse as you level up. If you have a mild allergic reaction, some of the symptoms you may feel include skin swelling and rash, itchy and watery eyes, congestion, and itchy. A mild allergic attack will not spread to any part of the body other than where it first occurred. In addition to the symptoms listed above, people who have mild allergic reactions may also experience a more intense itching sensation and difficulty breathing. Remember that if you have these types of allergic symptoms and your doctor diagnoses them as a mild allergic reaction, they can potentially spread to other parts of your body if left unchecked. In the event of a moderate allergic reaction, a doctor should be consulted. Anaphylaxis is the name given to the symptoms of an allergic reaction that is considered life-threatening. It is a very rare but potentially fatal disease. When a severe allergic reaction occurs, the body's reaction to an allergen is completely unexpected, intense, and can affect the entire body rather than just one part of it. The disease's first symptom may be itchy eyes and face, but it can quickly spread to include a wide range of additional symptoms that worsen rapidly. Anaphylaxis is an allergic reaction that can cause a variety of symptoms, including pain in the abdomen, bloating to varying degrees that can immediately affect a person's ability to breathe and swallow, cramps, vomiting, diarrhea, dizziness, and mental confusion. An extreme allergic reaction is a medical emergency, so get help right away if it happens to you. The vast majority of people with allergies are aware that they may experience symptoms of their condition. But it's important to remember that getting new allergies can happen suddenly and without warning, so it's important to always be alert to possible allergy symptoms. Allergy test. An overview of the different types of allergy testing. Your doctor may ask you to undergo allergy testing if you have an allergy that regularly causes you a lot of discomfort and/or if the cause of your allergy is unknown. First, he will perform a physical examination on himself, and if he is still not convinced that he understands the root of the problem, he will suggest an appointment with an allergist, who is a specialist doctor. If he is still not convinced that he understands the root of the problem in asthma and allergies, he will schedule you an appointment with an allergist. The first step in diagnosing an allergy is for the physician to obtain a good understanding of the symptoms experienced by the patient and an appropriate assessment of these symptoms. Your doctor will ask you a series of questions to rule out other potential health issues and also to get a better idea of what type of allergy you might be experiencing if you actually have one. Questions such as "what kind of symptoms do you have?" are examples of the types of questions you might be asked. Have you had these symptoms for a long time? When the symptoms first appear, how long do they last? Are your symptoms related in any way to the time of year? Do you smoke? Do you have any furry friends living with you? Are you experiencing a worsening of your symptoms? When are you indoors or outdoors? In addition to this, your doctor will perform a full physical examination of you, focusing particularly on your skin, eyes, ears, nose, and throat. The patient's doctor will carefully look for signs of an allergy, such as swelling, redness, drainage, and other symptoms. After completing this step of the allergy test, your doctor may want you to have other tests, such as a blood test or skin test, if they are still unsure about your allergy. Apart from these, there are also other types of allergy tests, such as those for food allergies. If it is determined that you are allergic to a specific food, your doctor may ask you to keep a food diary in which you record everything you consume on a daily basis, including beverages. This includes both food and medicine. To make a more accurate diagnosis of your allergy, your doctor may advise you to reduce or completely eliminate certain foods from your diet. Allergic injections. Do I need to get vaccinated for my allergies? The people who suffer with severe symptoms or who have allergies that have shown no signs of improvement over the years are usually the best candidates for allergy shots because these people have the greatest potential to benefit from a treatment. If you have used other types of medications in the past and experienced a number of unwanted side effects, allergy shots may also be a good option for you. Seasonal allergies, those caused by indoor allergens, and those caused by insect bites are the types of allergies that respond best to allergy shots. People with seasonal allergies, seasonal asthma, or hay fever are allergic to pollens found in grass, weeds, and trees, among other allergen sources. If you suffer from year-round allergies, you are likely sensitive to a number of indoor allergens. These allergens can include things like cockroaches, pet dander, mold, and/or dust mites. If you suffer from allergies year-round, you are likely sensitive to a variety of indoor allergens. Another category of allergy is the aversion to the venom of certain insects. When stung by an insect such as a bee, wasp, yellow jacket, or hornet, a significant number of people develop allergic reactions. If there is no other way to avoid the things that are causing your allergic reaction, it may help to get vaccinated against them. Allergies. Take, for example, the scenario where you are allergic to your pet's dander but refuse to seek a new home for the pet. If the allergy medications you've tried in the past or are currently using aren't enough to relieve your allergy symptoms, you may also find that using them can be helpful. If the allergy medications you are currently taking are causing unpleasant side effects or interacting with other types of medications, you should consider getting allergy shots. Allergy injections are effective instead. An alternative to consider if you want to reduce the amount of allergy medication you take long-term. Getting an allergy shot is a good idea if you have an allergy to insect or bee stings, as these types of stings can lead to serious health complications and even death in rare cases. If you've just found out you're pregnant, getting an allergy shot may not be the best thing to do. On the other hand, if you've had allergy shots and then find out you're pregnant, you shouldn't have a problem. You should not get an allergy shot if you have severe asthma that you cannot control or if you have conditions that affect your lungs or heart, such as taking beta blockers. People with any type of food allergy or persistent hives are not good candidates for allergy injections because they do not work. Urticaria. Treatment of allergic reactions. Available treatments for allergies. A person with allergies should consult either an allergist or an ear, nose, and throat (ENT) specialist to determine which treatment will be most effective for them. Once an allergy has been properly diagnosed, the next step is to determine the best way to treat it. Many allergists consider the role of environmental factors in the development of allergies and allergic reactions and are committed to providing appropriate advice to their patients regarding steps they can take to avoid allergens that may trigger an allergic reaction. If a person with allergies takes preventive measures, they may be able to reduce the severity of their symptoms and the frequency with which they experience allergic reactions. When it comes to treating allergies, there is a wide selection of medications to choose from, some of which require a doctor's prescription while others can be purchased without one. Antihistamines, decongestants, and anti-inflammatory agents are all very common over-the-counter medications. These include corticosteroid drugs such as cromolyn and nedocromil, as examples. These medications are useful because they help reduce the amount of inflammation present in the airways. Also, there is a type of low-dose corticosteroid nasal spray that is very effective in managing inflammation of the nose. People with allergies often use this spray, and it is easily accessible to them. Immunotherapy is an additional method of treating allergy symptoms. People with moderate to severe allergic reactions are recommended to have allergy injections. Children, in particular, can greatly benefit from these injections. Doctors have also recommended that people get allergy shots if they are unable to avoid what is triggering their allergic reaction, such as an allergen in the workplace or someone who is unwilling to part with his own beloved cat or dog. As a form of allergy treatment, allergy shots are given in 2 phases: the initial build-up phase and the ongoing maintenance phase. Patients receive 1 injection weekly, and the dosage is gradually increased as the patient develops immunity to the drug during treatment. This method of treating allergies, also known as immunotherapy, has been practiced for a long time. However, the results tend not to be the same for every individual. Most often, the patient has to undergo injections for a period that can last from 3 to 5 years. Allergy medications for allergic reactions are now available on the market. Most allergy sufferers will have required allergy medication to alleviate their symptoms. Itchy, swollen skin, a runny nose, and very itchy, watery, and itchy eyes can all be symptoms of an allergy. Allergies can also make your nose stuffy. Although there is currently no known cure for allergies, a wide selection of treatment options are available, including prescription and over-the-counter medications. Antihistamines, decongestants, combination medications, allergy shots and corticosteroids are the 2 types of medications that can be used to treat allergy symptoms. Antihistamines have been used for a long time and are available in the form of pills, liquids, nasal sprays, and eye drops. Nasal sprays are an option for treating bothersome allergies any time of the year, even during hay fever season. Antihistamines available only by prescription include brands such as Allegra, Clarinex, and Zyrtec. Benadryl, Claritin, and Tavista are some examples of allergy medications that are available without a prescription but can be purchased without a prescription. Decongestants are a type of allergy medication. Is particularly helpful in clearing congestion and can be taken in conjunction with antihistamines to provide the most effective relief of allergy-related symptoms. You can get them in different forms, including pills, eye drops, and nasal sprays. Some decongestants, such as Claritin D and Allegra D, are only available by prescription, while others, such as Sudafed liquid or tablets, Vicine eye drops, and neosynephrine, are available without a prescription. Antihistamines and decongestants are the 2 main components of combination medications, that is, medications that contain both of these components in 1 pill. They work together to rid the body of a variety of simultaneous symptoms that can be caused by a number of different conditions. There are also combination medications that combine asthma and allergy medications, as well as those that combine antihistamine eye drops with a mast cell stabilizer. There are also combination drugs that combine asthma and allergy medications. Over-the-counter options include Tylenol allergy and sinus and Benadryl allergy and sinus, while prescription options include Nafcon, Zadita, Vasocon, and Always XD. Prescription options include Nafcon, Zadita, and Always XD. Steroid medications, also known as corticosteroids, work to reduce inflammation and prevent and treat sneezing, itching, and congestion that are associated with nasal problems caused by allergies. Steroid drugs are also known as corticosteroids. In addition to their effectiveness against allergic reactions, corticosteroids are also useful in treating inflammation and swelling caused by other conditions. Steroids are a type of antihistamine that can be taken as a pill, nasal spray, cream, or eye drop. Steroids are also available in other formulations. Flonase and Nasonex are two examples of nasal steroids. Alrex and dexamethasone are two examples of steroid eye drops, and deltasone is an example of an oral steroid, or prednisone. Inhaled steroids require a doctor's prescription. These include the drugs Asthmacort, Beclovent, Flovent, and Pulmicort, to name a few examples. Another formulation, known as Advair, is a combination of a steroid and another class of drugs used to treat asthma and its symptoms. Allergy relief allergy shots provide allergy sufferers with long-term relief. If you suffer from allergic problems and recurring medications that do not respond well to a variety of medications, then allergy shots are the allergy relief method you should consider. This is also the case if the medications you take for your allergies cause negative side effects. The ability of allergy shots to prevent asthma attacks and reduce the risk of a child already suffering from hay fever developing asthma makes them an especially useful treatment option for children. It is essential to keep in mind that the only way to get long-term relief from allergies is to get an allergy shot once per month, and it can take up to 3 to 5 years of constant injections to achieve the desired results. The good news is that once the injections are completed, the allergy will often go away on its own, or if it doesn't, the symptom relief will continue for many years. Immunotherapy, yes, it comes in many forms, including allergy shots. In order to maximize the effectiveness of the immune system, each injection contains components that, when exposed to allergens, produce a hypoallergenic reaction. The injections contain the right amount of substances needed to perform their functions but not enough to trigger an allergic reaction. The allergist will gradually increase the dosage of the injections to give the body a chance to desensitize to the allergens by getting used to them, or becoming desensitized. This will make it more likely that your immune system will develop a tolerance to the allergen, which will increase the likelihood that allergy symptoms will go away. Allergy management follows a particular program that is divided into two parts: the construction phase and the maintenance phase. The build-up phase usually lasts 3 to 7 months and involves receiving an injection once a week to 3 times a week. During this phase, the dosage is increased to increase resistance to the substance. This paves the way for future allergy research and the development of long-term treatments for allergy symptoms. The maintenance phase is the one that lasts the longest and can take anywhere from 3 to 5 years to complete. When your doctor determines that you have reached your maximum tolerance for the allergy vaccine, you should continue to receive it at this level. You will need to have an injection once a month, and each dose of the injection will contain the same amount of the allergen causing the reaction. All of these things can provide long-term relief from allergy symptoms. Thanks for watching our video on managing allergies. We hope you found the tips and tricks we discussed helpful. Remember, it's important to work with your healthcare provider to find the best allergy management plan for you. Stay healthy and allergy-free, everyone.